Have you ever stopped to wonder how we really know if a medical treatment works? I mean, not just that it seems to work, but that it's actually truly better than doing nothing at all. It's probably one of the most important questions in all of medicine. So let's dive into the story of how we learn to tell the difference between just hope and real hard proof. And we're going to start with a pretty wild story about a celebrated treatment that fooled doctors for 2 entire centuries. It was a classic, written into textbooks, but as it turned out, it was a devastating mistake for so many people. Okay, so this timeline pretty much tells the whole tale. It all begins way back in 1785. A doctor, William Withering, hears about a folk remedy made from the foxglove plant. And for his patients with heart failure, swollen, breathless, totally weak, it looked like a miracle drug. So for the next 200 years, this drug, Digitalis, became the go-to treatment. But then we get to 1997. The first really big, rigorous trial drops a bombshell. It doesn't actually help people live longer. And what's even crazier, by 2017, we learned that for some patients, it was actually deadly. So this just begs the question, right? For 2 centuries, you had brilliant doctors and I'm sure very grateful patients who all believed this drug worked. How could they all be so wrong for so long? Well, here's where it gets really tricky. The thing is, Digitalis was doing something. I mean, look on the left. It absolutely made patients feel better. It eased their symptoms and it cut their hospitalizations by about a third. But, and this is the crucial lesson medicine had to learn the hard way, you see it on the right. Making someone feel better is not the same thing as helping them live longer. We were measuring the wrong thing the whole time. So to stop another 200-year mistake from ever happening again, medicine knew it needed a whole new system, a way to fight our own biases and our own assumptions. And this led to a revolution we now call evidence-based medicine. And at the very heart of this new approach is something called the evidence pyramid. Basically, think of it as a ranking system for proof. Way down at the bottom, at level 5, you've got the weakest stuff, a doctor's gut feeling or a story about one patient. But as you climb that pyramid, the methods get way more rigorous until you hit the very top, these massive, combined studies that give us the most reliable answers we can possibly get. Now, right near the top of that pyramid is the randomized controlled trial, the RCT. And this thing was a complete game changer. It's a system designed to be brutally honest with ourselves by randomly giving some patients the treatment and others a placebo, and then, this is key, blinding everyone so nobody knows who got what. You can finally separate what's a real effect from just our own wishful thinking. And, the entire system of evidence-based medicine, or EBM, is really built on one very humble, very important idea, which is captured perfectly in this quote. It just assumes that any of us can be fooled. Patients, researchers, and maybe especially doctors. It's about getting rid of because I said so and replacing it with because the evidence shows it. But here's the twist. This incredibly powerful system, the one that helps us figure out what works for huge groups of people, well, it has a major blind spot. And that blind spot is when it comes to one very specific person, you. Just look at this comparison. On one side, you have trial evidence, clinical trials. They study an average person in these perfect, ideal conditions. They often leave out older folks or people with a bunch of health problems. But on the other side, that's your reality. Your life isn't ideal or average. It's messy and unpredictable. You're a unique individual. The evidence is built for the group, but the decision has to be made for you, the individual. And this chart really nails the problem. When a trial comes out and says a drug is effective, that doesn't mean it works for every single person. It just means that on average, the benefited slice of this pie is a little bigger than the harmed slice. But when you're the one deciding whether to take that pill, you have no idea which of these slices you're going to end up in. Which, of course, brings us to the single most important question in all of medicine, a question that all this group-based evidence really struggles to answer on its own. So to solve this puzzle, the evolution of evidence is still going. The new frontier in medicine is all about bridging that gap between what works for the group and what works for the individual. Okay, one of the biggest steps forward is finally taking the patient's own experience and treating it like real data. These are called patient-reported outcomes, or PROs. They use official tools like questionnaires to measure the stuff that actually matters to your life, your pain, your fatigue, whether you can get through the day. And this is a huge deal because it makes how you feel a legit, measurable piece of evidence, not just some afterthought. And the next big thing is real-world evidence. This is all about looking at the data from millions of actual patient visits, all the stuff that's sitting in electronic health records and insurance claims.
It lets us see how treatments work over the long run in the messy, complicated, real-world patients who usually get left out of those perfect clinical trials. It's basically a reality check on all the other evidence. So what this all really points to is a fundamental shift in how we think about medicine. We're moving away from this hunt for the one single best treatment that works for everybody, and we're moving toward finding the most fitting treatment for you based on your own unique biology and what's important to you.
Okay, so what does all of this mean for you? How can you actually use this knowledge when you're making decisions about your health? Let's put together a quick toolkit.
You hear a lot of talk about AI coming to replace doctors, but its real role, at least for the foreseeable future, is probably going to be more like an evidence auditor. It's not going to be some new authority barking orders. Instead, it's going to help us sift through all these different layers of evidence, from the big trials all the way down to your personal data, to make the whole picture clearer for you and your doctor to talk about. Ultimately, this whole evolution, this whole story, is about trying to make medicine more honest. Honest about what it knows for sure, what it thinks it knows, and what it really doesn't know at all. It's about being incredibly, incredibly careful with that word effective. And that brings us to your toolkit. Think of these 4 questions as your personal filter for any health claim you ever hear. First, what's the real outcome here? Are we talking about survival and quality of life, or just a number on a lab report? Second, how do we know it wasn't just the body healing itself? Where's the fair comparison group? Third, what are the costs and the risks? What's the downside here? And finally, can other people check this work? Is the evidence out in the open, or is it somebody's secret? So I'll just leave you with this final thought. The next time you're talking about your health, ask yourself this question. Is the evidence here being applied to me like I'm just another number, another part of the average? Or is the goal to find the treatment that truly fits me as an individual? Because knowing the difference, well, that's the first step toward a more honest and a more personal kind of medicine.